wanted to share with you today about harm reduction. How many of you know someone struggling with addiction? I have struggled with alcoholism and know how hard it can be to break the cycle of addiction. I have been in and out of rehabs. My addiction to alcohol started around 15 years old. I struggled with severe depression and anxiety during my active addiction. There is so much pain. There is so much pain that addiction causes, not only for the addict and the alcoholic, but for their friends and family. It's hard to watch somebody go through addiction. I know I put my family, my friends, a lot of people through pain by the things that I did and the things that I said. So I guess I've been there, done that. To achieve my 3 years of sobriety, I attended AA, also found a belief in a higher power. It doesn't necessarily have to be like God or whoever is in the Bible, but just a belief in my own higher power. A way to turn things like my stress, anxiety, and stuff over to a higher power and know that I'm going to be taken care of. Along with professional counseling. I've been going to counseling in and out of counseling for years, but it finally stuck this last go around with sobriety. But what works for me may not work for others. So I think it's important to do whatever is possible to help the struggling addict or alcoholic. So what is harm reduction? In a quote from Fernandez Daniel in the New Republic Journal, unlike traditional drug interventions with the focus on getting people clean as quickly as possible, harm reduction emphasizes keeping drug users safe, end quote. It also helps to reduce the negative consequences of drug use, such as communicable diseases like HIV and Hep C. It also can reduce the risk of overdose and overdose-related deaths. How harm reduction is being implemented. One of the ways is outreach programs. These are places where people can be provided with things such as there's needle exchange programs. This is where somebody can go in with their dirty needle. I'm gonna focus more on because harm reduction is a little easier to explain in needle users or people who smoke versus alcoholism. There's a form of harm reduction for alcoholism, but I'll go into that later. So needle exchange, a place to exchange your dirty needles for clean ones. This helps also reduce the chance of communicable diseases like we talked about before, HIV, Hep C, those types of things. Also, sometimes you can receive Narcan. In a quote from Jesse Jeffries from the treatment of opioid dependence and overdose, naloxone, commonly known as Narcan, can rapidly reverse an acute opioid overdose by blocking the opioid receptors, end quote. In a quote from Gold K from Narcan, Narcan has long been used as a strategic resuscitation drug that can be given intravenously or aerosol into the endotracheal tube, end quote, which the endotracheal tube is just your nasal passages. After a Google search, I found out, according to CNN, 93.5% of people given Narcan survive an overdose, which is a really high rate. I didn't think it was going to be that high. You also can receive, and this isn't at every site, sites just get things donated, so what they have is what they have most of the time. Fentanyl testing strips, these are used to test fentanyl in different drugs, let's say they put fentanyl in heroin, which can cause an overdose if they don't know that there's fentanyl in it. This decreases the risk of overdose in some users. Some users still decide to take the drug anyways, and they'll just do a lower dose of it, which is scary, but what can you, do about it? Wound care and prevention. Wound care and prevention helps decrease the risk of injection site infections. I used to work in a clinic as a medical assistant, and people would come in, addicts would come in, and sometimes they would tell this elaborate story, this is what happened to me, but really it was from using a dirty needle, dirty injection, and they would get an infection called cellulitis, and this can be very dangerous, and it's painful. And I've seen people in AA meetings that have been formal IV users, and they have horrific scars from this infection. There's also kits for sterile injection that can be provided. These kits include things like syringes, tourniquets, sterile water, cookers. Cookers are just what they put the sterile water in and ignite. Bandages and alcohol wipes. Also education about injection. Education about injection is teaching people how to properly do a sterile injection, which sites should be avoided during injections as well. I mean, some people get to the point where their veins are so blown out that they have to do like in between their toes and stuff, and that's not really the best idea. Let's see, harm reduction isn't just outreach sites. It can be drinking less this week than you did last week. It can be used, you can use Suboxone instead of opioids. Like at some treatment centers, they'll put people on Suboxone instead of the opioid, which, I don't know if it's, I mean, in the realm of harm reduction, it's good. Different people in recovery view it in different ways, but I guess I would rather see somebody on Suboxone than out there like stealing and whatever to try and get their fix of heroin or whatever, have whatever opioid. It could be, also harm reduction can be using less opioids today than you did yesterday. It is about making small strides towards whatever the addict or alcoholic's goal is. Sometimes that goal is not abstinence. In my conclusion, it is not my intent to persuade you to believe that harm reduction is important. I only hope to spread awareness. I did know somebody that ran an outreach program in North Dakota. There really wasn't any funding by the state for it, so he was just going off of what people donated to him, whatever cash, whatever supplies. And I did hear something about a harm reduction program ran in Mandan, but I didn't really do any research or anything because that was a few years ago, so I don't know if they're still doing it. But I hope to see harm reduction become more common. People with addiction issues need to be seen and understood. Instead of demonizing them and throwing them behind bars, which brings guilt and shame and perpetuates the problem. Because I know, like, yeah, I've woken up in jail cells before and I'm like, how did I get here? And that only makes my situation worse because I'm beating myself up over it. I'm not saying that you shouldn't be punished for your crimes or whatever, but I just feel like we put so much emphasis on punishing people instead of helping them get better that it just perpetuates the problem. Recovery is messy. It takes internal work as well. I think with the help of outreach programs and some professional counseling, a lot of addicts and alcoholics could find freedom from the bonding of addiction. And then I have a little short video. It's only less than 2 minutes, I think, on harm reduction.